Over the last year, I have visited numerous local health departments, several of their boards of health members that I've met, amongst others, to learn, listen, and understand that how do we move forward to modernize our current public health system. We commissioned the Public Health Impact Task Force, or FIT, last year to look at ways we could improve and do business better and provide services necessary to our communities. In addition to the 10 FIT meetings, we've had numerous meetings of the Association of Local Health Departments, Public Health Partnerships, and others. We have begun a number of other activities, such as newsletters, making sure that we are conducting governance trainings, and we will also be holding local health officers summits. We have informed our public health partners in local neighborhoods and communities that over the last year, given the fiscal climate, that we are anticipating significant budget cuts. So the current budget proposal, of course, comes as no surprise. For many years, our state had to subsidize programs and services. As more residents than ever before are insured today, it's time we now move forward with shifting this financial burden from the backs of West Virginia taxpayers to insurance companies. Today, we're here to announce that DHHR has proposed legislation that will be introduced by House and Senate that will have a three-pronged approach, providing increased flexibility to local health departments while modernizing our public health system in West Virginia. The first prong of this will be to allow local health departments to maximize the billing of insurance to insurance companies for clinical services. This legislation would give local health departments the flexibility to diversify their revenue stream by billing insurance companies at the maximum allowable rates in all 55 counties. Many health departments have requested to be able to bill at the maximum allowable rate without having to go through the bureaucratic process that exists today. I'll give you an example. Several years ago, working at the Kanawha-Charleston Health Department, I realized that if we were under billing, meaning if for any particular service, if the maximum allowable rate was X, and we were several dollars behind that, there is a lengthy, drawn-out process that has to go through in order to achieve X, and sometimes it takes years to get there. This includes being able to develop a plan, justify the use, get approval from local boards of health, publish those rates, await public comments, submit it to the Commissioner's office for approval, and only then, while the citizens continue to suffer, as well as the local health departments. We want to remove those barriers. We want our local health departments to be able to bill at the level that insurance companies are willing to reimburse. A report today by Dr. Deskins from the WVU's Bureau for Business and Economic Research at the College of Business and Economics will discuss in a few minutes that says that by maximizing billing for clinical services, local health departments could generate nearly $4 million if they use the Kanawha-Charleston model that I had helped set up, or up to $7.7 million by using the billing model used by Mon County. So this is something that we are tremendously interested in. This has the potential to not only replenish any budget cuts, but increase revenue by the local health departments. Currently, in essence, we're leaving money on the table. I also want to emphasize that these revenue increases potential comes from billing for services already being provided. Our intent is not to compete for services with private providers, but complement those services that are existing in local communities across West Virginia. Additionally, I think it's important to note that the proposed state budget cuts of 24% does not mean 24% cut for every local health department's budget. What do I mean by that? Well, based on the total agency budget submitted to us by local health departments, we estimate that the real impact on the budgets of all revenues coming into a health department to be about an average of 10%. What that means is the more diversified your independent agency budget is, the less likely the impact of these funding cuts will be on your agency. And in net, it will be about 10%. It is critical to have a diversified business model with multiple revenue streams that offsets the impact of any reduction in state funding. This will provide greater flexibility to enhance sustainability of public health programs across West Virginia. A prong two of this legislation is to ensure that public health programs are evidence-based with measurable outcomes and resulting in administrative efficiencies. We know that West Virginia today leads the nation in arthritis, disability, cardiovascular diseases, COPD, diabetes, and drug overdose deaths. In fact, we're number one in drug overdose deaths. And we're a close second in obesity and hypertension. When you look at these risk factors, addition to smoking and fair to poor health status, I think it's unacceptable for us that we can do more, and we must do better. This legislation will allow us to work collaboratively with local health departments to ensure operational plans are evidence-based with measurable outcomes. This will guarantee cost-effective and efficient utilization of our limited resources across the state while improving health outcomes. Using this approach will actively be able to ensure that residents have access to programs that can make a difference in their lives and the lives of their children. We owe it to every taxpayer in West Virginia to be good stewards of our resources. It makes sense that we're all using programs that can lead towards a better health for all West Virginians. Prong three is to ensure that the Bureau of Public Health is able to assist local health departments in emergency situations when the provision of basic public health services in a community is threatened. I'd like to go back to 2013. If you remember, at the time, there was a situation with our neighboring Putnam County. Putnam County's both board members as well as county commissioners and Commissioner Haynes and Commissioner Skidmore were willing to do anything that required to be able to get things back up. It was difficult for our partners, as I was a local health officer at that time at the Bureau, to able to act conclusively. At that time, we spent hours and hours in trying to figure out how to do this. And I understand and I realized that Secretary Bowling, at the same time with her team, was doing the same at DHHR and the Bureau of Public Health. And what resulted in is today you see the product, which is a program in Putnam County that has expanded services, being served well to their citizens, and generating revenue. It's all because there was an ability of a neighboring county health department to go in and help. However, what's most important is they were able to bill and generate revenue. We do not want that situation to be repeated again. We would like to make sure that when those situations are happening as a result of financial crisis, disease outbreaks, and a multitude of other conditions, that there is a way to collaboratively work towards solutions without hurting the public's health. The legislation we're proposing today puts the health and well-being of all West Virginians first, regardless of where you live, regardless of your zip code. From day one, I've been committed as State Health Officer and Commissioner, Bureau of Public Health, to work with our federal, state, and local partners to do what we can to improve the health and well-being of West Virginians. We believe that this legislation is a first step in the process by affording local health departments with the additional flexibility in billing, which will generate revenue for local health departments and the opportunity to focus on evidence-based services. This is the trend. This is the future of public health. So what we're doing today is in a lot of ways innovative, but it's also, we're not only leading the nation, but this is something that is being discussed, considered, being published and researched, that the public health systems in the country must modernize themselves in order to remain sustainable and thrive, not just barely survive.